Your fancy ass shoes. I just noticed your fancy shoes.
These are my running shoes. Got these because my other running shoes hurt my feet. Then I got a Peloton, and now I mostly do that.
So now you just wear your funny shoes?
No, I wear my running shoes. Welcome, and welcome back. Hey.
Hey.
Hey. Hey. Hey. In this video, we're going to talk about knee pain and back pain and kettlebell training. But first, we got to have some context with that, right?
Yes.
Otherwise, we're just throwing it out there on the internet like everybody else. So let's start there. Let's just start with some context, Roger.
Okay. I'll give you some context.
Okay.
So the context of this video.
Okay.
We shouldn't be making this video. This video, in my opinion, is a waste of time. This should go without.
You should watch it. Let me just clarify. Watch this video.
We're making it because we think we have to. We have received an influx of concerns about knees, backs, other physiological problems, other injuries that may be happening due to technique. We don't think we should have to make videos like this, but unfortunately we do. The internet is a silly, silly place. You get a lot of people who speak with very little information about things very emphatically. And although it would be nice to just not respond to these people because they are silly people who don't know things, we don't want them to have the last word. And the purpose of us making these videos is so people can learn and at least get another viewpoint. So what we suggest, don't believe us. Never believe anything we say.
Look it up.
That's stupid. Look it up. Go out there and see if there's in fact another opinion. We've both been doing this a long, long time. Over me, I don't know about you. I've been doing this over 20 years and I've seen a lot of stuff. I've seen fads come and go. I've seen a lot of information, and most of it has not been accurate completely. Some of it's been accurate, some of it hasn't. Some of it's accurate, and then 10 years later it's not, and then it is again. So things switch.
Yeah.
That's the context of this video. The context of this video. So let me state emphatically that kettlebell training does not hurt your knees and it does not hurt your back if done appropriately, and it is done for a person who is injury-free, and we're going to get into that a little bit. So that's the context of this video.
All right, so there you have it. All right, but first, let's put a little bit more on this, and let's talk about kettlebells. And there are a few different styles in kettlebells.
Yes.
There's a hard style, which we practice and coach mostly, and then there's a sports style.
Only we don't know anything about the other stuff.
That's right. That's true. Well, I practice it somewhat, but not well, All right, I won't even claim that. We'll cut that out. All right, there's hard style, which we do, and then there's sports style, which other people do, and then there's probably the Wu-Tang style, which some people do.
I don't know that yet.
All right, it's for the kids.
One of the first things you're going to get is when people are directing their comments. Perhaps they come from a sport background or a hard style background, and they're saying, "Oh, you're doing it wrong." One of the common things I get from both people. From both sides, people who practice sports style will see someone using their knees like, "Oh my God, you're going to destroy your knees," or "Hey, you're squatting it, you're not hinging it," and they learn a different type of swing. It's a pendulum swing. It's a flat back. They use a lot more momentum than hardstyle does. It's a completely different thing with different objectives. One thing is not the same as the other. It's not, neither is better, neither is worse. It's just they're different. But when someone comes from one background and they see the other, like, "Oh, you're doing it wrong." A lot of hardstyle people will watch someone in sport and they'll have, this kind of rack here, which makes a lot of sense when you're going for endurance. The load, it's like, "Oh my God, you're going to blow your back out." You're not going to blow your back out. The load is actually going down in your hips. And if you took a minute to read about some biomechanics and physics, you would understand where the load is going. Or if you asked one of these sport people, "Hey, what's the deal with that?" which is what we should be doing, like, "Hey, tell me about this," rather than "You're doing that wrong." Okay.
Troll.
So it goes back and forth. But before you look at a technique and decide that it's wrong, you need to understand, well, wait, what is this person's background? Okay. The next thing we need to look for is individual differences. Even within hardstyle, which we'll restrict this conversation to because that's all we know about, even within hardstyle, there are going to be different people who swing different ways. We've said this on our videos before. We have different swings.
Yeah.
We've got different body proportions. I tend to be a little squattier. He tends to get a little hingier. If I do my swings the way he does, and people have tried to make me change, it hurts me. It hurts my body, and I don't like it.
And that hurts me that you're hurt.
I appreciate that.
Yeah.
It's not like the sport. So I can't do things his way. He can do them a little bit more my way better, but either way, he performs a lot better with his own technique. So you need to understand individual differences, and then you need to understand where is somebody in their training cycle. If you're somebody who's had an injury and you got injured in a particular way and you think, oh, that's going to be really bad for X because, I hurt X, it doesn't necessarily track. We need context before we can even talk about what may or may not be bad. So another thing we've been fielding again lately is swings. When we do a hardstyle swing, and we very firmly believe force comes from the floor. And if you're not contributing with your quads, if your knees are not doing anything, then you are leaving a ton of force on the table.
Shame.
That may be different. That may be different for certain people based on body type. Maybe they can't get a lot of knee bend. But if you can get that knee bend, and again, you don't need to agree with us, but if you can get that knee bend and you can use your quads and you can generate more force by using your quads and moving those knees, then I think you should do it, as long as you're injury free and you're not harming yourself.
Good.
That's just flat out what we believe. I've never seen anything to counter that. Moving a healthy joint through a full range of motion at multiple speeds is something I've always read is healthy. Now, I'm not talking about in any kind of pathological populations. We're not saying, hey, I just had my knee replaced. Should I go do hardstyle swings? I don't know. Probably not.
Get a little clearance, Clarence. All right.
You should probably go for a walk first. But the point is that this is what we believe. This is what physics and biomechanics tell us. This is what all of the reading has done that we have seen. So the idea that it's inherently bad for your knees just seems unsupported. I've never had a substantive argument about this with anybody, because people don't offer evidence. They just say, hey, this is bad. But there are reasons to believe that if there are muscles between the ground and the kettlebell, that you should probably use them in order to move the kettlebell, if your objective is to move the kettlebell with a lot of force.
Yeah.
And if you, again, moving a joint through its full range of motion, healthy range of motion at any speed is not going to be bad. Moving it too much, there's always a breaking point. Okay, too little, too much, things tend to get hurt. We have problems. I have a history of knee problems. I've had them since I was probably 10 years old. Kettlebell training, specifically swinging the way I swing, snatching the way I snatch, has gotten me stronger than I've ever been and kept me pain-free.
Yeah.
That training with kettlebells and actually doing heels elevated squats where my knees go past my toes, those are the things that have gotten my knees out of pain. And this has been a consistent thing over years. And then you get the argument, well, you feel good now, just wait. Well, okay. Well, if that day comes, then
we'll do another video. And
we'll do another video. Consider me wrong. But
put a big thing on the screen.
Things have evolved. So if you find yourself in a place where you think that using the knees is bad because everybody's quad dominant, whatever that means. A lot of people have really weak quads. I've tested many people. They actually get a lot stronger, and people get out of pain often when you get the quads stronger. But if you think using the knees is bad because people are quad dominant, that everything needs to go back into the glutes and the hamstrings, that the quad shouldn't work. If you think that using a kettlebell is bad for your back and that the spine should never flex. These are things that have been around. They were around when I started training, and they have all been disproven by somebody else at some point in some context. That even people who are big proponents of, hey, you probably shouldn't flex your spine that much, never say don't flex your spine. So these things all have a context, and if you don't have a context, you don't have an opinion. And I'm going to say that if you don't have context, you don't have an opinion. If you think that this is bad without understanding that, you're wrong. Save yourself the breath. Figure out what it is you need to know to substantiate your opinion. Ask a question rather than, looking at someone with a sports style rack and saying, hey, you're going to blow your back out. Maybe ask them what they're doing. Yeah. And then you're probably in for a conversation, because a lot of these people who practice sport really know what they're talking about, and you're going to get a lesson in biomechanics that you weren't prepared for. So,
and then who will look silly? Things just evolve, Remember, doctors used to recommend smoking. Camels, I think.
Was it? Were those healthy ones?
Yeah, those are the doctor recommended cigarettes. We don't recommend those.
Another common one I want to talk about just real quick is that a squattier swing is going to hurt your spine. It just does not work that way. Again, every time I hear a squatty swing's going to hurt your back, I never hear a reason. I hear, I see like some kind of horrible pantomime where people are doing this, that's just no good, trust me. That doesn't work. You need to substantiate your argument. And when you go through all of the phases of a swing, one, this is bad for your back is not an argument. Okay. Now, if you give me a paper that says squatty kettlebell swings are bad for your back, I'll believe you. Maybe, actually.
We'll probably read it and then maybe look for another paper to corroborate that.
That's what you do. But the idea that they're inherently bad is just wrong. And when people demonstrate them, what they usually demonstrate is a squatty swing where the arms are not integrated into the body. And in this case, you're not loading the spine with the kettlebell. You're not combining your center of mass. That can be problematic for your spine, but it's not because of the movement patterns, because you have a bad swing.
Yeah.
Bad swings are bad for your spine. So
bad for your life.
So, some of the common ones, again, your knees can't go past your toes. You should never flex your spine. Only work your glutes, never your quads. Don't go to full range when you're squatting or, because those are bad for your knees. Never do knee extensions. A lot of these things are still passed along by doctors who, by the way, almost never have any exercise training.
And aren't usually fit, to be honest. I mean,
talk to them. I've trained dozens of doctors throughout the years, and they're awesome to talk to, and they're well aware of what they don't know. But these things we should look into. So again, there's nothing inherently bad about the knees. There's nothing inherently when you do your swings. Kettlebell swings are not bad for your back. Get some context before you offer an opinion. And if you find yourself trying to say this is wrong or this is bad, just tell me why. Well, a common one is the T-Rex swing. Should your arms be long or straight? Oh, I don't do T-Rex swings. Okay, that's cool. That's fine. We don't need to have a discussion. You can say I don't teach them, but the second you say you're bad, you need to teach me why they're bad. Mm-hmm. And most people don't do that. They have an opinion and then they stop. And if you find you're in that place, if you find that you're in a place where you're starting to have a pronouncement, look it up. You're not going to find answers readily. Trust me. I've done this for a long time and tried to find answers. They're not really out there. They're hard to find. You got to piece them together. But make sure you have context before you have an opinion. You can't have an opinion without the context. It just doesn't work. And I think I'm done.
All right.
I'm done ranting.
All right, commenters, heard it from him first. Now, if you're somebody who's watching these videos and reading the comments and think, oh, this person's absolutely right all the time, again, we implore you to explore around. There are tons of good kettlebell coaches out there, and there's tons that are shitty. I'm not going to name names, because that'd be rude.
We don't have time.
We don't have time. So make sure, just take a look. Get the context. Don't be a jerk. Download our app, Bells by Iron Revival. And we're going to link a couple videos on swing types and how to set up for your swing and snatches and all that crap right here in this video. So you check it out.
Yeah, and if you disagree with us. We'll have a good conversation. Just make sure you have a point. This is bad is not a point. Tell me what's bad, tell me why it's bad, and we can start having a conversation. That's how we learn. And if you teach me something, I appreciate it.
And don't be a name dropper either. You better know what's up yourself. All right? Cool. Stay strong. We love you.